So I think this is perhaps one of the most exciting areas. So I've talked about prognosis and prediction of outcomes. I think we may see more of those kinds of things. So not just prognosing disease, risk stratifying disease at the point of screening or diagnosis, but selecting the right therapies based on retrospective analysis of what worked best for particular patient types. The more we stratify patient types, the more we understand how different subsets of stratified populations respond to therapies, the better we'll be able to prospectively prescribe to those patients that have those set data criteria, if you will, or those eligibilities, so to speak. And so in a way, we can start to personalize and individualize treatments in a much more proactive way. And undoubtedly, that's going to take so-called big data. It's going to take tools that will be able to explore databases, visualize data, expose those data to AI that's being retrospectively developed, and then, of course, putting them into an environment that can be used within the clinical workflow effectively, fundamental to adoption. So I think we'll see many of these sort of islands of capabilities around data aggregation tools, AI orchestration tools, predictive algorithms for point solutions, so to speak, workflow solutions starting to be aggregated and used within the clinical context. It's a very fragmented world that we live in the healthcare environment, particularly when it comes to data silos and different tools. The more we can create an ecosystem where these things can work interoperatively, the better. So I think we'll see many more of those. There'll be focus on specific use cases, particularly selection of certain therapies or stratifying certain diseases. And we'll need to work with physicians, caregivers to sort of pull those things together. But we'll see these islands, I think, slowly coming together to form ecosystems of capability that will support improved outcomes. And, all of that's essential, but it's also critical that we work together to make sure that happens. And we're seeing some of that happening already in specific care models like rapid diagnostic clinics, or monitoring of recurrence clinics, for example, or indeed infusion clinics and so on. These sorts of capabilities need to be tied together and used in a more uniform and integrated way.